So typically when we hear that, it's in relation to people saying, gee, I was taking an antihistamine and it seemed to work for the first couple of days and now it doesn't seem to work anymore. And it probably relates to specifically the antihistamines, that when you're exposed to something you're allergic to, histamines release and it kind of peaks within about 3 to 5 days or so and then goes down after about 7 to 10 days. There's not a lot of histamine release, and therefore people oftentimes will take an antihistamine and say, gee, it worked for a week, and after a week it just doesn't seem to help anymore. It doesn't help because the histamine itself really isn't the cause of ongoing symptoms after about 7 to 10 days. If you get repeated exposure again, you may get a burst of histamine, but again, that's why antihistamines tend to be really poor drugs used chronically to treat allergies. So short-term side effects, basically, discomfort at the site of injection. One thing for people. There's always a risk, no matter how long you've been on allergen immunotherapy, of experiencing systemic side effects, potentially life-threatening, even anaphylaxis, although it's rare, but it can occur. Some people may see a temporary worsening of their symptoms on the day that their immunotherapy is administered or subsequent days. All those things can be ameliorated or lessened by the use of certain medications, which can be prescribed by the treating physician. I think, neti pots are interesting, so it depends upon how you make up the solution. So you can make a solution that's less concentrated than your normal tissues, which is a bad thing to do. That will lead to rebound nasal congestion. You can make up a solution that's the same concentration as the fluids in your tissues, which would basically have a flushing effect. Or you can make up a solution that's called hypertonic, a little more concentrated, which actually has an effect in terms of changes in terms of mediated release and protective effects, very similar to what nasal steroids do. So the other nice thing about nasal saline irrigations or hypertonic nasal saline irrigations is actually they help reestablish your normal anatomy, right? So if you have a mucus blanket on top of your nose, believe it or not, nasal steroids won't penetrate effectively through that. So one of the reasons that we see in terms of poor response to nasal steroid is the lack of delivery to the nasal mucosa. So doing a nasal saline irrigation beforehand, if you're just going to do just a normal concentration, will help flush off that mucus blanket, and allow better contact and penetration of nasal steroid. And nasal steroids get absorbed within a second when they're sprayed in. So it's not, if you sneeze 5 seconds later after using nasal steroid, you haven't sneezed the medication up.
All right, so translating in my English.
Yes, they work. Well, it's kind of like driving a car. If the speed limit says, there's a curve coming up and you shouldn't go above 30 miles an hour, and you decide to ignore that and drive 100 miles an hour, you're probably exposing yourself to, certain dangers you shouldn't be. So the label on there, the label doses may not be the optimal dose for each person, but over a population of people studied, they basically said this is a dose which tends to be safe and also provides some effectiveness. So those labeled doses are on there because they basically tend to reflect more safety than benefit. So I would say take them, seriously. Your physician may prescribe different doses, and the physician is there to help determine, what's the optimal dose for use in an individual, not necessarily what's on the label, and then to discuss the potential side effects may be there if you're using doses other than the label dose.